goal is as far as treatment. Now, there are some patients that would like to have improvement in the skin tone, and that is something that can be treated with various types of topicals. One of there are various types of skincare programs, and they're all probably equally as good as one another, but the important thing is to be able to remove some of the oils in the face to allow some of these medicines that are going to be applied to the skin to actively treat it. For example, after removing the oils and having a proper cleansing, to apply something along the lines of retin A, for example, tretinoin acid, and that is applied to the skin, and it can help deepithelialize some, or I should say, improve the skin, the outer layer of the skin that can be treated to smoothen it out and to rejuvenate that area, to exfoliate it. And there are other types of topicals that can also be placed in order to improve skin tone, like hydroquinone, which is a skin lightener. And the skin lighteners are advantageous in things in treatment of melasma, which is a blotchy appearance of the skin that can occur. So all these different types of skincare products all have their attributes, but for the most part, it's more of like an exfoliative type of treatment that can be applied at home. And of course, as we advance more to more aggressive types of treatments, you can actually remove some of the wrinkles in different types of chemical peels. So these skincare programs can be also used as a preliminary treatment prior to undergoing a chemical peel test for rejuvenation purposes.
Mm-hmm. So there's quite a few things in our armamentarium that we can use to not just improve the wrinkles, but the skin tone, because really, if you want the best effect, you want to improve the skin texture, the skin dullness, and as well as some of the wrinkles there. As a question here that we have, Dr. Doherty, in regards to the fillers that you were mentioning, what is, I mean, we use the general term fillers, but what is it that the fillers contain? What is it that we're using to fill in that space? If you don't mind kind of expanding on that a little bit.
Sure, of course. So there's been a number of different fillers on the market, and are currently a number of different fillers on the market. Most common ones that I think we all probably use most frequently are hyaluronic acid fillers, and so it's a synthetic form of a substance that's found naturally in your body, and it augments by filling in the soft tissue and is temporary. So the effect is generally going to last somewhere around a year, but it varies a little bit depending on the location in which you're filler. There are some other fillers that last longer, and some actually that have some permanent effect as well. But there's some downsides to a permanent filler, because any problems that are caused by the filler are also potentially permanent. So generally, we like to use fillers that are temporary. The hyaluronic acid fillers are also advantageous because they're reversible. So there is a medication that we can place into the area that was filled that will dissolve the filler, make it go away if there is unwanted effect, or there's too much, or it doesn't look like it's placed in the right area. So it allows us to really tailor the treatment and correct any potential irregularities that might result as well.
Mm-hmm. And Dr. Dobratz, with any procedure, there's always a possibility of some type of complication that could occur. What are some of the steps that you employ to ensure, first of all, patient safety, that they get the best result they can, and the safest to be performed the safest way it can be performed?
Yep, and you're exactly right, and that's something we want to make sure that we're eliminating as much risk as possible, but with any procedure, you really can't completely eliminate all risks, and so we want to make sure, number one, the patients are completely educated on what those risks or downsides are, and then that we are doing everything we can once we've kind of established what they are to prevent them. And so it really depends on the procedures that we're talking about. And, we've talked a little bit about Botox today. We've talked a little bit about fillers. We've also talked about some of the surgical procedures that we perform. With Botox, the risks are relatively minor. It's very safe, as we've talked about it. Kind of, Dr. Vianis had talked about its history and how it started off being used more for functional reasons, and then kind of moved over into the cosmetic realm. But really, the injection sites, you could get a little bit of a bruise or some redness or irritation from the actual needle poke itself to apply the medication. Those are pretty unusual. If they happen, they're pretty short term. There's very rarely that people get kind of an allergic type reaction to it. That's really, really unusual, but it can happen and is very temporary. It's affecting muscle movements, and so if the fluid itself that's injected migrates, particularly if you're doing it around the eye itself, it could migrate down onto a muscle that opens up the eyelid itself. If that fluid then eliminates or reduces the muscle movement there, then the eyelid itself could droop down. They say it's about a 1% chance, but in reality, it's way less than 1% chance of having that. But it can still happen. It's called a ptosis, and that's certainly something that could happen with that medication. There are some drops that can be given on the eye to stimulate a different muscle to go ahead and lift that eyelid up, and then that effect of the dropped eyelid is often more temporary than the effect of the elimination of the muscle movements that work on the wrinkles. Usually within about 4 to 6 weeks, people would start to get function of that, and the ptosis would improve. So that's really kind of the main things with Botox. With fillers, again, there's a needle injection to apply the medication or the solution, the filler underneath the skin. So there can be bruising associated with that, or again, an allergic reaction. When people used to use collagen as a filler, more often there was more chance of an allergic reaction. You would actually do a test to make sure that the people weren't going to develop an allergic reaction for that. With hyaluronic acid fillers, as Dr. Doherty has mentioned, they're really kind of the most popular filler that we're using right now. One of the reasons of that is that people tolerate it very well. The chance of having an allergic reaction is very unusual. It still can happen, but we don't test for it ahead of time or anything like that. The most significant risk that could happen with a hyaluronic acid filler is as that medicine's going in, let's say it's going in the nasolabial fold, there are deeper arteries in that area. It could possibly get into the artery or blood supply itself, or it could actually just push on the artery, which would affect blood flow to tissue, and you could have tissue loss or damage. That's exceedingly unusual, but it's certainly something we want to talk about. The technique of the delivery of the medication can be very effective in trying to minimize that risk. The other risk that they talk about with injection around the eye, again, exceedingly unusual. You could get blindness if that medication got into one of the arteries around the eye. Again, that's very unusual. And the technique where you're putting the medication itself or the filler is used in a way to try to minimize those unfortunate risks.
Mm. So knowing the anatomy of the face, knowing what you're doing is very, very important. I think that's also one of the things that Dr. Vianis had brought up when mentioning the EVMS Aesthetic Center. It's just us providers that actually do the injections. And, we've had years and years of experience in doing them. Obviously, an occurrence could happen with anyone, but we have protective measures and, safeguards to minimize those risks as much as possible. We're having some questions coming in from the audience, so I'm going to address one question. This question was from Kim. With the pandemic, we got to wear the masks all day long, especially at work in the health centers. And the question is, does the mask negatively impact the skin? And is there anything that we can do to help? So I'd like to maybe just chime in, and then I'll ask my colleagues if they have anything else they'd like to add. We have been seeing some effects from the mask, especially depending which mask that you're wearing, how tight it is on the skin, maybe if you have some underlying skin conditions to deal with already. Some of them can cause some bruising, so some broken blood vessels. So we've seen some, what we call sometimes purpura, that can occur on the skin. That usually does resolve. Part of that has to do with the irritation, the rubbing, and the pressure that can occur there. There are some individuals that might have an underlying what we call rosacea. This tends to be this type of redness and blushiness that occurs on the cheek, and sometimes that can irritate the skin enough that it produces even more redness, and sometimes even little bumps that can come up. That can be medically treated, and if we see in the office, we can prescribe some medication for that. There is a skin condition also called seborrheic dermatitis, which is almost like a dandruff that can occur around the face, especially around the nose, around the eyebrows, particularly if you have maybe a little bit more oily skin. We do prescribe some medications that can help reduce that. In general, though, I think it's always good after you take off the mask, because this was an area that's been kind of confined for a period of time, to go ahead and wash your face with a gentle cleanser. And a moisturizer is always good to kind of provide or promote healing of the skin. There are other things that can be employed, especially if you notice that your pores are kind of getting blocked up more because of the use of the mask. Like Dr. Vianis was mentioning, the retinoid or the Retin-A is the brand, Tretinoin is the generic name that can kind of help exfoliate some of that. But the moisturizer would probably be the key thing that you definitely want to do. Which one's the best one? Like Dr. Vianis was mentioning, there's a lot of brands out there. A lot of them can have very good or provide very good results. There are some over-the-counter brands that have perhaps maybe a little bit more ceramides. There's a brand called CeraVe. There's a brand called Vanicream that has less ingredients, especially if you have very sensitive skin. Some people like Cetaphil. Cetaphil has an oil control wash also that they use, especially if you're more prone to very oily skin wearing the mask. So those are a couple of things that I would suggest. I know when I take off my mask at the end of the day, I kind of wash my face thoroughly, and I do put a little moisturizer on just for the fact that with too much washing, my skin does kind of dry up a little bit as well. There's always the question about whether or not an astringent is necessary. With the products that are available over the counter, you really don't need an astringent, but some people do like it, especially if they have very oily skin. So, Dr. Jordy, there's also another question came in from Yasmin. Are appointments open right now to get scheduled for Botox and fillers if some of our our public is interested in that?
We do have appointments open. So we've had we took a break from scheduling new visits in the office during the onset of the pandemic. But we've opened our offices up back now with new safety measures, limiting the number of visits that we're having so that patients aren't having to wait in the waiting room, and offering other alternatives so that they don't have to wait in the waiting room. And then we're following all of the necessary precautions, including all of our staff wearing masks, wiping down the rooms in between visits, and actually mandating that every patient who comes in also wears a mask. So we are open for visits, and we're open for visits for Botox and fillers and anything else that someone wants to come in and see us for, and we're doing it in I think as safe a way as possible.
Yes, totally. And some patients would just like a consultation, but that's fine too. Sometimes we're able to fit some of the procedures in that same day as a consultation as well. And depending what the goals are and what desires are, and how much product and time we may need. So that's great. Question also about Kybella. We hear that sometimes in on the internet. Dr. Vianis, what is Kybella? What do we use that for?
Well, Kybella is a substance actually that's secreted from your gallbladder to emulsify fat. It's deoxycholic acid, and it's used for dissolving fat cells, basically dissolving the lipid, and then your body absorbs it, and then it gets secreted through your liver back into your intestine. That's how you excrete the lipid tissue. So primarily it's been FDA approved for the fat layer that accumulates behind your chin area and your neck. There's a space there that may have some extra fat tissue. And by injecting the substance, the Kybella, into the fat layer, you can dissolve some of the fat. Now, the amount of reduction might be about 20%. It may take several sessions. There is some pain that could be associated with it that could be treated with some of the non-steroidal anti-inflammatory drugs like ibuprofen or Motrin. But for the most part, it's a substance that can dissolve some of the fat. As far as predictability, it varies from patient to patient. The results could vary depending upon patient selection. Those patients that have more elasticity of their skin, that they can have rebound once that fat is dissolved, and they can have rebound of the skin, and those patients will probably have a better result than a person who's older who may have more skin laxity. And therefore, even if you dissolve the fat, you'll still have some hanging skin there. So again, patient selection is important in using the Kybella.
Okay, great. And for some that are maybe don't prefer to do the surgical route or perhaps surgical liposuction, this may be an option for them. But again, the evaluation is key to see if the person is appropriate for this type of treatment. Dr. Doherty, are any of these procedures covered by insurance typically?
So it depends on what, I guess, the scope of what we're talking about. In general, Botox and fillers are not going to be covered by insurance. There's some rare exceptions to that. Sometimes we use Botox for patients who have injury to the nerve that moves their face, and so we're trying to treat some of the muscles that are having aberrant movements. But in general, Botox and fillers not covered by insurance. There are other surgical procedures which are potentially aesthetic and functional, meaning that the problem that the patient sees you for is not just one of wanting to change their appearance. The common one that both I and Dr. Dobratz do may be a rhinoplasty, where a patient has trouble breathing through their nose and also some concern about the way the nose appears. And so we can combine those two procedures, and a part of the surgery can be covered by insurance. The other common one that we do for the eye area would be a blepharoplasty, or an upper eyelid lift, as well as a brow lift. And that's more commonly a procedure sought out for improvement in appearance or rejuvenation of the eyes and forehead. But if a patient has visual obstruction from the excess skin on their upper lid or ptosis or hanging of their brow, then insurance can also cover those procedures with documented visual field testing.
Great, thank you. Dr. Dobratz, we have a question from Nancy. Everyone's talking about vitamin C, cure for everything. Any benefits that you have with vitamin C, perhaps applying it topically on the face?
Certainly, there are people that have talked about benefits of that and many other things. I think when it comes down to it, really a good skin regimen that you had kind of discussed, with some exfoliation, moisturization, sun protection, I think are the kind of the key, ingredients to healthy facial skin. I think anything outside of that may help some, but I think if people are looking for, kind of a foundational treatment for optimization of their skin, it's really those three key factors: is exfoliating, moisturizing, protection. So, I think there are a number of things that come out. People talk about the topical retinoic acid, or the topical hyaluronic acids and things like that, or topical collagens. And I think there's a number of different cosmeceuticals, essentially these topical, treatments for facial rejuvenation. And I think any of those, really looking at it as far as the science is concerned, with true good studies that have kind of compared, use of that with a placebo per se, and controlling for, the changes, and evaluating those in a scientific eye. Really, a lot of these other things that people come out with don't really hold, true to making big changes. Really, I think it's just those key kind of preventative things and trying to minimize aging. We aren't going to stop aging, and aging is still going to happen. But certainly, I think those kind of key ingredients are going to help with optimizing the way that our skin ages. And some of these other things can certainly, I think, be helpful, but I think we kind of have to do those things with the idea of small, improvements, and they're probably not going to be big time changes. And I would say vitamin C would be kind of along those lines.
Yeah, I agree too. Very good points. I mean, I think we all hope to live till we're 100, but if we're going to live there, we're not going to look like we're 20 anymore, right? And we're going to hopefully age gracefully. I think the photo protection or the sunscreens, those are amazingly what they can do to kind of help reduce the aging. Obviously, a lot of times when we talk about sunscreens, we talk about skin cancers and reducing those, but just the
recording has stopped.
Just the wrinkles that can occur from too much sun exposure is amazing.
Recording has started.
So they've looked at twins that have lived in different areas. One that's lived in a very sunny area, loved to tan, versus another one that didn't and would always sun protect. And even though obviously they're twins, one looks 10 years older than the other, just from their practices that they do. So so photo protection, moisturizing, the retin-A or the retinoid type products, that has also been showing to reduce fine wrinkles. But I think to your point, Dr. Roberts, a lot of these things it's not the fountain of youth. It's not, super drastic changes, but these little things can help with very fine lines, improve perhaps the brightness of the skin. Vitamin C as an antioxidant, I think it is becoming a lot more prominent in some of the products that we're seeing coming out. There are, pretty affordable options. People don't have to spend $300 anymore for a vitamin C serum. So using it doesn't hurt as long as you're not sensitive to it. But yeah, they're not going to be the super drastic ultimate answer to see that change night and day, but it can definitely help. So here is another also question. I'm going to actually throw this to Dr. Vianis. It's from one of our participants named Susan. Are there any non-surgical treatments for saggy skin? Maybe let's break it up to sagging skin, maybe like the jowls that we can see at the jawline, and perhaps sagging skin that sometimes people experience like under the arm or around their belly.
So, there are different levels of skin laxity, and as you mentioned, the jowl area for non-surgical treatment, you can mask it by putting the filler in front of the area of the jowl. So if you have some of the descent of the fat as you get older, you lose the elasticity. The fat compartments in the face can become atrophic, and they may also drop a bit, creating an extra amount of tissue that kind of hangs lower than the jaw, saying a straight jawline. And so one of the things that you could do to mask is just to put a little bit of the filler in front of that jawline, just to give it a more smoother appearance. So that would be more of a masking thing. But there are other treatments that can be used, again, depending on the laxity of the skin. Now, one of the more recent technologies that have been further developed is radiofrequency treatment, and that is a sort of thermal type of treatment that actually spares the outer layer of the skin, but heats up the deeper layers of the tissue to get some contracture of the collagen. So these are some of the more recent advances in that. Radiofrequency has been around for a long time. There have been various levels of improvement. A lot of it has been temporary, but there are some other radiofrequency devices that are out there that can cause some tightening of the skin. So I think, again, you have to evaluate the patient for what is, as far as the treatment of that laxity of skin, because some patients have had massive weight loss or have had a lot of stretching of the skin, maybe from pregnancy, and you can actually see the broken dermis or the tissues that are deeper where they have the stretch lines and stretch marks. Those are very hard to treat non-surgically. So I think, again, it all depends on the patient and where the laxity is as to how you're going to manage it if you want to try non-surgical management. But the majority of these patients do require some type of surgical intervention.
Great, thank you. Um, Dr. Doherty, I kind of pretty prominent now, and especially a lot of the celebrity or social media influencers are all about all these lip enhancements, from lip flips and lip lifts and those kind of things. Can you describe maybe some of the techniques that we use to attain some of those desired results?
Sure. Yeah, I think there's really three main procedures out there to help augment or highlight the lips. One would be filler augmentation of the lip, and so we have different types of fillers, and some that are particularly useful in the lips to help augment the lips while maintaining sort of a soft and natural and hydrated appearance to the lip. And I think a technique with lip injections really matters a lot, because there is the potential to create overly widened or unnatural looking lips, and that is not what most patients want. So augmenting the correct areas is really crucial. The lip flip is placement of Botox into the upper lip muscle to help allow the lip to roll out. The changes with the lip flip are a bit more subtle, but one of the benefits is that it's certainly less likely to lead to any kind of unnatural appearance that could happen with bad technique with the fillers. And the final option for lip augmentation, and one that is particularly useful in the aging lip, is as we get older, the white part of our lip tends to elongate and the red part tends to get thinner. And so a surgical lip lift, which is a simple procedure which can be done even just under local anesthesia in clinic, is done by making a small excision of skin just below the nostrils, in a place where the scar hides in the shadow under the nose, and reducing the length of the white lip and helping to roll out the red lip to allow for.
Great, thank you. So we have a couple other questions coming in. One question from our friend Jody, mentioning that there's a dark spot that recently appeared on the face. She went to one provider that had told her that it's just an age spot, not cancerous, nothing to really worry about. Can these spots be removed? And there are a couple of ways to actually approach them. Some of these spots can be removed through like chemical peels that can be done, and that can be done as a full face to kind of brighten up the skin and peel off some of those top layers. Like some of our colleagues were mentioning, that the retinoids that kind of help exfoliate the skin, that can be also something that can be employed there. We do have also a couple methods where we'll use a very cold gas called liquid nitrogen, or the term is cryotherapy, that we can apply to that area that will help exfoliate and lighten up that spot. And sometimes we'll even use electrodesiccation, which is like an electric needle to kind of scrape off some of those top layers of skin to help lighten it up. For those kind of concerns, it's best to kind of come in and we can kind of see how big it is, how thick it is, and what the best option is. Obviously, if there's any brown spots, we always want to make sure that they are not a worry for any types of skin cancer, especially melanoma. Sometimes it does require a biopsy first, but since you already had it evaluated, I'm sure it's probably fine. And then Dr. Doratz, another question from a friend Carol. As I'm getting older, skin tags are becoming a lot bigger problem, especially around the face. There's a lot of commercials out. There's over-the-counter creams. There's concern of using those, what kind of reactions they could get. Typically, what do you do for skin tags? Maybe, let's say, stuff that you see around the neck or maybe around the eyelids. And then do you recommend sometimes any over-the-counter products for those things? And
yeah, so exactly, the neck and the eyelids are kind of the areas where I tend to see those most. And if they're true skin tags, I think, cryotherapy, is an option. You had mentioned that's something not really over the counter, but it's something that's non-surgical. You can kind of freeze skin lesions off. They may require a few treatments to get that to come off completely. If they have a very narrow base, so skin tags can, they're all different shapes and sizes of those, so they can be with a narrower base, and those can very easily just in the office be kind of snipped off and really sometimes don't even require suture. They just kind of heal right over. If there's a little bit of a wider base, that might be something that you would excise with a stitch or two just to close off. But I find kind of removal of skin tags to be probably the easiest way to take care of them. It's really not a big recovery. It's something that can be done in the office with just a little bit of a anesthetic to numb up the area. Sometimes you don't even really need that, depending on where it is. Sometimes there are little deposits underneath the skin that can be mistaken for, especially around the eyelids, that can be mistaken for skin tags that aren't. That can be little milia, or they can be little cholesterol deposits, or they can be little trapped, little ducts or little follicles around the skin that can have little, collection of skin cells in there and things like that. So really, having somebody evaluate that to kind of see what exactly the small lesion is. And then kind of counseling you on what could be done. Sometimes they can just be unroofed or opened up, and some of the contents that's trapped to be removed, or if it is a true skin tag, can be excised. I haven't found a lot of over-the-counter treatments to be very effective. Maybe you have, Dr. Pradanovic, seeing people in the dermatology clinic, but most of the ones that I've seen, we've kind of just treated very simply in the office.
Right. I think the office is probably quick and cleanest way, perhaps. Some patients have actually mentioned that they've used different techniques like nail clipper and those kind of things, but some of these skin tags can bleed like stink. So luckily in the office we have tools to prevent that, and also kind of do it in a more clean method. I think a lot of the topical treatments that are over the counter, they will either have like salicylic acid, which helps kind of peel off the skin. There are some things that can help constrict some of the blood flow to that area, and then over several weeks of use, they can fall off. I haven't personally tried any myself. I've had some patients come in after they use them, and they've developed what we call a contact dermatitis, or a severe irritation from the cream, just like some individuals may develop that type of irritation after having a Band-Aid on their skin too long. But typically it's so easy to just do it in the office and take care of those that by the time they see me, usually we do something procedural. So, and then Dr. Gaddis, this is a question from Sarah. Thinking about getting Botox, but I work outside a lot during the spring and summer. Is it safe to be outside in the sun right after a Botox injection?
Well, the Botox is injected into the muscle layer, so the only restriction would be the first 24 hours, avoiding a lot of stooping, bending, that sort of thing. Just taking it easy the first 24 hours is important, but the actual skin puncture, probably not a bad idea just to keep it covered, or wear a wide brim hat, just only because if you have multiple of these little needle sticks in your skin, it may get irritated a bit from the sun, especially if your skin is has more pigment to it. There's always the possibility of maybe causing some post-inflammatory hyperplasia. I should say not hyperplasia, but hyperpigmentation. Right, exactly. That could cause a little bit of skin darkening, but it's very temporary, and it should heal in 24 to 48 hours. That little needle stick. They're very fine needle sticks. They're probably the smallest needles that are made. So I think just taking it easy the first 24 hours or so will be fine.
Yeah, I agree. I think it's only when, for example, I may do some chemical peel procedures, then I will kind of make some recommendations as far as staying out of the sun for a while. But most of the injections, since they're going deeper in, besides the risk of where the needle poke is, it's typically safe to continue doing your normal activities. So, well, we've come up onto the hour, so I appreciate everyone's participation and presence. Is there any comments my esteemed colleagues would like to make, or?
Well, I think I'd like to just say, go ahead.
Go ahead, Lambros.
So I just wanted to say a couple of things, and we threw out a lot of different ideas here as to rejuvenation and things that we could do to improve, one's facial appearance and other areas on the body that are so many different types of modalities. But I think the most important thing, again, is having a blueprint, or sort of a treatment plan as to how you're going to treat a patient, because you could sit a number of doctors in one room and you'll get 10 different ideas on how to treat one thing, and you'll probably get 10 great results. It all depends on, the approach and that person's experience in treatment of managing patients. I think there are a lot of different ways of doing things, a lot of different methods that are available to us. And again, coming up with a treatment plan for short and maybe long-term results as to how you want to approach your problem that you want to correct.
And so Dr. Dorbatz, you wanted to add anything?
Yeah, I was just going to say, I think just for the audience, we just kind of the Aesthetic Center, we've talked about some of the kind of the unique offerings of the Aesthetic Center. One of them is this kind of multidisciplinary approach and talking about, all of these different areas, some areas within our expertise, and everybody has a little bit of a different expertise, and so that's great. And we hope to continue doing this in this venue, this kind of educational sessions, and so just be on the lookout on our Facebook page for more of these. We're going to try to continue to do these every few months and kind of get together and talk about different topics. And certainly I would encourage any participants to let your friends know and just be on the lookout for future events, and certainly be ready with questions, because we're happy to try to educate the people out there on some of the different treatments that we offer and the things that we have available at our center.
Thank you. Well, thank you, Dr. Dorbatz. Thank you, Dr. Vance, Dr. Doherty. Thank you all for joining us. Keep the questions coming, and we'll definitely present them at our future seminars. If there are no other questions that I don't see, and if there are no other comments, we'll go ahead and end the session. Thank you very much. Have a great evening. Bye.